Hello and welcome to Saliva Cast, the podcast where evidence-based salivary science meets your clinical practice. I am your host, Dr. Deborah Heller, a dentist, a scientist, professor, and founder of Saliva Pro. And my mission is to help you, the clinician, use salivary diagnostics to enhance precision, personalized care, and improve outcomes in your daily practice. And today's question is simple, but yet very powerful. And I ask you now, are you a proactive dentist or a reactive one? Because when it comes to oral health, waiting for the lesion to appear is already too late. Let's face it, most of dentistry is still very reactive. We wait for the cavity to show, the tooth to break, the gum to bleed, and then we act. But science is clear. The lesion is the final event of a process that started much earlier. Think about caries, for example. When you see a white spot lesion, that process didn't start yesterday. The patient's mouth has been giving signs for weeks, for months, sometimes years. Dry mouth, persistently acidic pH, decreased salivary flow, microbiome imbalance, behavioral factors like mouth breathing or dietary patterns. The same happens with tooth wear, halitosis, gingivitis. And here's the truth. If you're diagnosing the lesion, the disease in place already, when it's already visible, you are late. It's a reality, dentist. We must face it. But the good news is today we have tools to shift from reactive to proactive dentistry, and saliva is the key. Dentistry needs to stop waiting for the lesion to appear. By the time a patient arrives in our office with an initial caries lesion, their body has likely been giving signaling imbalance for weeks, months, maybe even years. And many times, those messages were in saliva. These are not small details. These are red flags from a system under stress. Before caries shows up, the body has already asked for help. But if we keep waiting for visible damage to act, we are already behind. Saliva is the link between real prevention, early diagnosis, and smarter treatments. It reveals metabolic, inflammatory, immunological, and lifestyle imbalances long before enamel breakdown occurs. You can today in your clinic, if you're listening to me from your dental office, you can today monitor early signs in your clinical practice. I show exactly step by step of how to do this. At my Saliva Pro online course, you can also find many of the protocols on my YouTube channels, Deborah Heller on YouTube, and on Instagram. I have now an all English spoken Instagram profile, Dr. Deborah Heller on Instagram. And this is so evolved, saliva monitoring in dental practice, that there are even already devices that allow you to monitor in real time. Devices like iTooth or Lura Health. They have developed, for example, at Lura, clinical aligners, mouth guards, and orthodontic brackets with built-in pH sensors. Yes, you listen to it right. devices capable of real-time monitoring of demineralization risk and acidic imbalance during orthodontic and sports treatment. Aligner doctors, if you're Invisalign practitioner, if you recommend invisible aligners to your patients, if you're a sports dentist, special for you, Nick, in Georgia, orthodontics, can you imagine having that data at your fingertips? That technology isn't available where I am right now in Brazil, but it could be available where you are. It's for sure already available in the United States. But the truth is, the future has already arrived and it's in your clinic. With Saliva Pro method, it doesn't matter if you're in Brazil, if you're in Georgia, if you're in Italy, if you're in Liechtenstein. You can already perform a validated, efficient, and actionable salivary diagnosis in your daily practice. You can measure salivary pH in your daily routine. You can and you must measure saliva flow rates and other clinical saliva markers to anticipate risks and personalize care. Excellence in dentistry, my friend, must be proactive, not reactive. And that's the path to a more accurate, valued, and differentiated care. Let's go to your clinic. Maybe you're listening to this between two patients, and I'm so glad you tuned into Saliva Cast. Actually, if you're enjoying this episode, make sure you share, you post on social media, invite all your dentist friends, all your colleagues to join us at Saliva Cast. And as always, I want to bring you a practical example. I want to bring you a practical example of how to bring saliva testing to your clinical practice, how to be a proactive dentist. Let's start with an example every dentist knows. White spot lesion. That's the earliest visible sign of enamel demineralization, right? But let's be clear. When you see it, the biological imbalance was already there. What kind of imbalance? It could be a reduced saliva flow. It could be acidic pH environment. It could be microbial shifts towards acidogenic species, compromised salivary buffering capacity. All of these changes happen in saliva before the lesion is clinically visible. With a simple saliva diagnosis test, you can detect the pH, you can monitor flow rate, you can detect saliva buffering capacity, you can already monitor early microbial shifts. And when you have this data, your decisions change. You reinforce remineralization early. You implement dietary and behavioral strategies. You personalize home care, oral hygiene protocols, far beyond generic advice. Who says the patient needs to brush twice a day with any toothpaste in the market? No. That doesn't work anymore. We need to individualize oral hygiene prescription. And you dentists have to do this based on real data, based on salivary diagnostics. This is how you stop being reactive and you start being proactive. Oh, Deborah, very nice, but we do not see caries anymore. What we see today is tooth wear, non-caries lesions, tooth sensitivity. Let me give you a practical example how this applies to tooth wear. Let's talk then about something that we're seeing every day more often, right? In our clinical practices, tooth wear, non-caries lesion. This is what science shows us. Lower salivary pH is associated with increased tooth wear, especially during nighttime or in stimulated saliva. Reduced buffering capacity weakens the natural defense against acids. And even healthy individuals may experience nocturnal pH drops that silently contribute to enamel erosion. And it gets worse in patients with gastroesophageal reflux or acidic diets. Studies confirm that patients with reflux are 4 times more likely to show significant tooth wear. But saliva helps and plays a protective role if the buffering capacity of saliva and its flow and quality are adequate. Salivary testing in clinical practice gives you a clear data on pH balance, buffering capacity, flow quality. And with that, you move from reaction to prevention, remineralizing strategies, dietary counseling, management of acidic habits, saliva stimulation when needed, clinical results, less frustration for you, less frustration for your patient, less irreversible damage, more predictable outcomes, more health, more successful clinics, data-driven prevention, not guesswork. Let's make sure you understand. I want to bring you one more applicability, a practical example. Let's move to a condition that affects not only teeth, but also social confidence, halitosis, bad breath. And here's something very few dentists check. The microbiome balance is a major driver of halitosis. A healthy salivary microbiome keeps volatile sulfur compounds under control. But when saliva quantity or quality drops, or when pH shifts, bad odor producing bacteria thrive. In a recent clinical case from our own practice, the patient had halitosis despite perfect hygiene and no cavities. A salivary microbiome analysis showed severe imbalance, low diversity, anaerobic overgrowth, and signs of acidic stress. The saliva of my patient wasn't protecting him anymore as it should. And with saliva diagnostics, I can detect microbiome imbalances, low flows rate, acidic pH favoring anaerobes, and you connect stimulating saliva, buffering strategies, microbiome modulation, individualizing hygiene protocols. This isn't cosmetic. This is clinical, biological, and science-based. Dentist, listen to me. The future is here. Still thinking this is the future or the present? Let's go back to Lura Health. Check this out. Lura Health is developing clear aligners, mouth guards, orthodontic brackets, all with embedded pH sensors. Imagine this, the aligner itself tracking acid exposure in real time. This is for you. This is for me. This is for our patients. Think about having this data during treatment. This is already in development in the US. This is already available for American dentists. This is already also being developed in Europe for European dentists, soon in Latin America dentists, soon all over the globe. But here is also the reality. You don't need to wait for the device. You don't need to wait for the aligner with embedded pH sensor. With the Saliva Pro method, you already have a validated, efficient, and accessible tool to track saliva pH, flow rate, buffering capacity, microbial risk, symptoms, xerostomia, oral dryness score. It's all in your hands today. Act. Be proactive. Dentist, here is the bottom line. Excellence in dentistry must be proactive, not reactive. If you wait for the lesion to show, you're already late. But if you use the data, the saliva data provides you, you become a dentist who truly prevents, protects, and personalizes care. This is how we build smarter, science based, and modern dentistry. If you want to learn more or to apply this in your clinic, I invite everyone to follow Saliva Cast. Make it a favorite here in a favorite podcast streamer. Send us feedback. Follow us on YouTube, Deborah Heller on YouTube, on Instagram, Dr. Deborah Heller on Instagram, and of course, you're always very welcome on Saliva Pro Hub. Dentist. Let's transform dentistry together with science, with precision, with prevention, and proactivity. I'll see you at the next episode of Saliva Cast. I am Dr. Deborah Heller, and this is your Saliva Cast. Thanks so much.